Mount Carmel employs over 8,000 highly trained nurses and staff, partners with over 1,500 physicians and specially trained surgeons, and utilizes over 1,000 volunteers, all to make your stay and your outcome as good as it can be. Our 4 hospitals, Mount Carmel East, Mount Carmel West, Mount Carmel St. Anne's, and Mount Carmel New Albany, as well as our surgery centers, outpatient facilities, physician offices, and community outreach sites, make us one of the largest healthcare providers in Central Ohio. Because families and loved ones play such a significant role in your healing, Mount Carmel encourages visiting. Please check with your unit for visiting hours. Upon arrival, you'll find free self-parking on surface lots and on the parking deck, or you can valet park for a fee. Cell phones are okay as long as they're at least 3 feet from any equipment used in treating patients. And yes, Mount Carmel offers free wireless internet access. However, Mount Carmel is not responsible for lost or stolen items. We strive to make your stay as personally comfortable as possible. You can request a special diet based on your religious or personal practices with your doctor's approval. You can also get assistance from a registered dietitian or clinical diet office employee if you have special needs. When your visitors are hungry, they can enjoy our well-equipped cafeteria, offering hot and cold entrees for breakfast, lunch, or dinner. And if you get hungry between meals, no problem. Just ask your nurse for a little something to tide you over. You can also call dietary services to order food anytime between meals. You or your visitors may also enjoy our chapel. We offer both Catholic and Protestant services on Sunday. Check your patient guide for times for this and many other services here at Mount Carmel. At Mount Carmel, we understand how important it is for your loved ones to receive timely information about your condition and care. We also believe that it's important to maintain your privacy. So before your surgery, you'll be given a find code. This code is the key that your chosen contact person can use to obtain status and updates about your stay. That person may view your status in the surgery waiting room by finding your code. This code can also be used to get updates over the phone. Please understand that without this code, we cannot give out any detailed information to anyone. Once you've completed registration, you'll be taken back to pre-op holding. You'll change into a hospital gown and have your vital signs taken. Your pre-op nurse will prepare you for surgery. Your operating room nurse will also meet with you and your support team and review your medical history and answer any questions you or your support team may have regarding your procedure. Your operating room nurse will also be with you the entire time during the procedure, helping care for your needs. Your anesthesiologist will explain to you the type of anesthesia to be used. There are many types, and the right one for you depends upon your medical condition and the type of surgery to be performed. At Mount Carmel, we believe that the first line of defense against post-operative infection starts before the operation, so we maintain a sterile environment throughout the operation. It is because of you that we take these extraordinary precautions to prevent infection. This all takes time, as well as the operation itself, so you can expect your surgery to last anywhere from 3 to 8 hours, depending on the specific operation being done. Your surgeon will visit with your family after the surgery in the waiting room. If they need to step out for a few minutes, they can leave a phone number with a volunteer to avoid missing that important conversation. When your operation is complete, your next stop is PACU, or simply recovery. Your recovery nurses will be monitoring your oxygen level and other vital signs. They will also keep a close tab on your pain level. You may have a dry mouth, nausea, itching, chills, or feel confused. Tell your nurse if you experience any of these symptoms, and don't hesitate to tell them if you awaken with pain. You'll stay in recovery until the effects of anesthesia have satisfactorily worn off. Every patient responds to anesthesia differently, so your time in recovery is difficult to predict. You may have completely recovered, but still have to wait for an available room to be transferred to. Since your family is not allowed here, make sure they know that extra time in recovery is not necessarily a cause for concern. The first thing you'll do when you get to your room is meet your nurse and nursing assistant for that shift. They will perform a head-to-toe assessment, checking your heart, lungs, and other vital signs. They'll be checking in on you frequently for the first several hours. They will keep close tabs on your pain level. While pain after an operation is to be expected, we know you will have a more successful recovery if we can keep your pain at a manageable level. So you will be asked frequently to rate your pain. This will help us know how well your medication and other comfort measures are helping. You can use a number or choose a face on this scale that best rates your pain. If you were already on pain meds before your surgery, your post-operative pain may be more difficult to control. Nurses will not automatically give you pain meds unless they know that you need it. So don't wait until the pain is out of control to ask for medication. It will be much harder to get back under control then. We have a wide range of treatments available to us to help manage your pain. They include medications ranging from oral to IV to direct injections in the operative area. And we also find simple methods to be effective too. Your nurse will work closely with you to determine the best plan of care for you to achieve a successful outcome. It's important to always have a plan. That's certainly true with a plan of care for recovery. Your plan of care starts with good hand hygiene. One of the best things you can do to improve your outcome is to protect yourself from infection. And your first line of defense is to clean your hands, often. It's easy, cheap, and effective. Everyone should do this, especially before coming into contact with you, even the associate taking you for a test or serving you dinner. If they forget, don't be shy. Remind them. They won't mind. When washing your hands, be sure to lather your palms, the back of your hands, and wrists. Rub them together on all sides, between your fingers and around your nails for at least 15 seconds before rinsing. An alcohol-based hand sanitizer is a convenient, easy alternative when your hands are not visibly dirty or soiled. Just place it in your hands to moisten the front, back, and fingers. Rub it in and keep rubbing until it dries. Some of the biggest keys to successful outcomes lie in things that you don't do, and the biggest one of these is don't fall. Sounds like common sense. No one wants to fall down, but falling down can be the very worst thing that could happen to you during your recovery. You may have never fallen down in your life, but things are different right after a major surgery like this. You could fall down for a variety of reasons while attempting to walk by yourself. So here at Mount Carmel, we have a policy. Call, don't fall. We want you to call for help anytime you need it to get up, no matter what time or how many times that is. Your plan of care also includes a primary care physician. While your surgeon focuses on your operative area, you may also receive a visit from a physician to make sure everything else is okay. Another important part of your plan is your diet. Even though you are unconscious during an operation, your body uses lots of calories during and after surgery, so you may find yourself wanting a big meal after waking up and getting into your room. Unfortunately, even though you are awake after surgery, your digestive system is not, and any solid food you take in on the day of surgery may come right back out. So depending upon the type of anesthesia used, your diet may begin with ice chips and slowly progress to clear liquids such as broth, gelatin, popsicles, and clear soda. Once your nurse or physician feels your stomach is able to handle solids, you will be able to start regular food. Your physician may order medications to help with digestion as needed. You may not have a bowel movement before leaving the hospital, but you will at least be passing gas to ensure everything is working okay. Even though your digestive system doesn't start back up right away, your bladder does. So you may come out of surgery with a Foley catheter in your bladder to drain urine. You'll have that for about a day unless it's needed longer. The most involved portion of your recovery plan is the therapy, occupational and physical. Occupational therapy teaches you how to accomplish everyday personal care, while physical therapy exercises and strengthens the muscles around your operative area. We encourage you to have anyone that will be staying with you at home attend the in-hospital sessions with you. Your doctor may tell you ahead of time that you'll need to wear a back brace or corset after surgery. You will be given instructions on how to have it made and fitted, and your nurse or therapist will show you how to wear it. Your key to a successful recovery is to always wear your brace as directed by your doctor. You'll be helped out of bed and walking soon after your surgery if you're able. You will be expected to walk in the hallways at least 2 times a day. Of course you can walk more, but always remember to call your nurse before you get out of bed to walk. You'll need to be aware of how you sleep in bed during your recovery. You should not sleep on your stomach unless your doctor says it's okay. When sleeping on your side, place a pillow between your knees. Also, use neck and waist support as needed. You'll get into and out of bed using a log roll technique. The purpose of log rolling is to avoid twisting your spine at the hips when moving around in bed. You should log roll while in bed every 2 hours to stay flexible. To roll to the left, bring your right knee up and place your right arm across your chest. Roll your entire body in one single motion to the left. Just reverse this for rolling to the right. Then raise up using your arms, not your back. Swing your legs out in one smooth motion. Keep your back straight while standing up. Getting into bed is just the reverse of getting out. Remember, no bending, lifting, or twisting at the waist. Your first step after surgery will be from your bed to a chair. Back up to the chair, rest your hands on the armrests, and keeping your back straight, lower yourself into the chair. No twisting or bending at the waist. Remember to keep your shoulders over your hips during movement. Always sit in a firm chair with stable armrests. You'll be encouraged to sit for all 3 daily meals and for 30-minute intervals. Getting out is just as easy. You want to first scoot close to the edge of the chair and have your feet firmly planted on the floor. Bend forward at the hips, keeping your back straight, and use your legs to stand. When using a walker, be sure that you don't push off with the walker. When it comes to vehicles and your recovery, the taller, the better. A taller vehicle is easier to get in and out of than one that's low to the ground because you don't have to bend as much. You're safest sitting in the front seat with your seatbelt on and the seat upright. Every major surgery bears general risks. Yours is no exception. What is exceptional is the length to which Mount Carmel goes to minimize those risks. You should discuss any concerns you have about the risk of surgery with your surgeon. The lack of activity immediately following surgery increases the risk for blood clots to form in the veins. Daily activities like walking and getting up and down out of a chair actually help keep your blood flow strong. Your patient care team will employ several types of treatments to minimize this risk. Be sure you tell your RN immediately if you have any shortness of breath, or if you have swelling, redness, pain, warmth, or tenderness in your calf or lower leg. Pneumonia is also a risk after surgery. You'll be taught deep breathing and coughing exercises to help keep your lungs clear and free of fluid buildup. Being active after surgery will help to prevent pneumonia, but being active before your surgery will also help. Also, since smoking increases the risk of pneumonia, you should consider quitting before your surgery. Your physician can discuss smoking cessation strategies with you. Infection is also a risk with surgery. Did you know that being overweight, being a smoker, or having diabetes can increase your risk of infection? Ask your doctor or nurse for help in managing these risk factors. Your operative area is at risk for infection. This can occur while you're in the hospital, but most often, if it occurs after your discharge. You will be given IV antibiotics before and after surgery to help prevent infection. You'll also be given complete instructions on incision care. Spinal surgery carries one additional risk. A cerebrospinal fluid, or CSF leak, can occur with a dural tear. This is rare, but if it happens, it will be patched during surgery. Flat bed rest is required to promote adhesion of the patch and can last for 24 to 72 hours.